The Commissioner of the Food and Drug Administration, Dr. Stephen Hahn. Dr. Hahn, good morning, and thank you for being with us on an important day.
Good morning, Savannah. Thank you for having me.
As we know, this outside panel meets today to consider the Pfizer vaccine. Could approval of the vaccine come as early as today or tomorrow?
So I'm not going to prejudge what the advisory committee, which is a non-binding committee of scientific experts, will say to us. We'll have to see what the scientific and medical discussion is today. But our plan is to take their recommendations into account for our decision making and make a decision shortly thereafter. Again, it really depends upon the complexity of the issues discussed, but we intend to act quickly.
It's interesting you say non-binding. So could this panel raise questions or say, oh, we need to delay it, and the FDA say, well, we're going forward anyway? Has that ever happened before?
So there are scenarios like that have been experienced by the agency. We have the advisory committee to get outside opinions about this. We think it's very important for transparency. We're the only regulatory agency in the world that has such a public vetting of the data. But we'll make that decision. Our scientific experts will make that decision.
And to be clear, is this a formality? Is it a foregone conclusion this vaccine is going to be approved, or is there a genuine question?
So it is not just a formality. We take this very seriously in terms of having the transparency around our process. It's why we have outside experts, because issues, medical issues, scientific issues could be raised that need to be addressed. But again, we'll make that final decision. I have complete confidence in our scientific reviewers and their assessment of the data.
As you know, the UK has already started putting shots in the arm and is now advising that those with significant allergies, such that they would carry an EpiPen around with them everywhere, that they should not get this Pfizer vaccine. Do you expect the FDA to issue a similar advisory when and if this vaccine is approved?
So it is possible. We're working with our UK partners now to understand exactly what happened with respect to those reactions. We take this seriously. It's one of the reasons, Savannah, that we at FDA do such a careful review line by line of the patient data, is because our label around a vaccine will not just say who should get it, but who should not receive the vaccine.
And did you, I know you know the data well, I mean, did you see allergic reactions like this and what's in the clinical trials?
So this is something that's going to be discussed today, so stay tuned for that. But what I can tell you is that the side effects associated with the vaccines are very carefully recorded. We put our data out on Tuesday that is going to be discussed today. We think that our initial assessment is that that this is a vaccine that does meet our criteria, but we do want to hear from the Vaccine Advisory Committee.
As mentioned, a recent survey found that just about 60% of Americans were willing to get the vaccine. You need a higher number to break the back of this pandemic. But there was also another concerning number. 41% said they would want to wait a few months. Now, is that concerning to you? People saying, you know, let me just see how this all plays out.
It is concerning to me, and that's because when it's appropriate medically or from patient or from people characteristics point of view to get the vaccine, it's really important that people carefully consider their decision, because as your previous reporter said, we need to get to herd immunity, and that requires a substantial percentage of Americans to be vaccinated. So that's why we've been transparent. It's why we want this public discussion of the data. It's why we've been very careful about the review of the data, and we'll make a very careful decision, understanding, of course, the importance of the situation and the urgency of the situation.
You brought me right to my next question, because on the flip side of that carefulness is people feeling like, hey, wait a minute, the UK has already given people shots. Canada just approved it last night. What's taking the FDA so long? Is this just a bunch of Washington bureaucrats kind of covering their backsides?
Not at all, Savannah. This is FDA is known around the world as the gold standard regulatory agency for authorization or approval of products. Our people, our scientists are world class. Their mothers, fathers, brothers, sisters, grandparents. They understand all that's happened during the last 10 months. We've also been there with the American people, and we understand the urgency. But we also have a very solemn promise to the American people. Our job is to assess the safety and efficacy and do that well. And we've shrunken a process that normally takes months into one that's taken weeks. Yeah. And I have 100% confidence in them, and I believe the American people should as well.
I was thinking about you this morning. You were appointed and you were installed into the office. You became FDA commissioner 1 year ago exactly. 1 year ago, we hadn't even heard of the coronavirus. And 1 year later, we're on the eve of approving one, maybe two, maybe more vaccines. What's going through your mind on this occasion?
Well, it's a really important day for all of America. It's an emotional one, obviously, because the country has been through so much in this pandemic. It has been, it's affected so many lives in devastating ways. And as we think about how we're going to get beyond this, a vaccine will be the primary way in terms of stopping the spread beyond the mitigation efforts we need right now. And so if, in fact, there is an authorization and we begin vaccinating a national vaccine campaign, there is great hope, great light for this country. And I think we all look forward to getting beyond this and having a more normal and healthy life.
We do indeed. FDA Commissioner Dr. Stephen Hahn, thank you for your time and your work. We appreciate it.